It's time for WorkCompTalk, coming to you from the Pacific Workers Studio in Concord, California. It's WorkCompTalk. Interesting people talking about the issues that affect the lives of the everyday people that keep our communities moving. Sponsored by Pacific Workers Compensation Law Center, the lawyers for injured workers. With offices in Concord and Oakland, Pacific Workers is the leader in California workers' compensation, representing injured workers throughout Northern California. PacificWorkers.com, the lawyers for injured workers. Now to your hosts, Eric and Carmen.
Hi, welcome to another episode of WorkCompTalk. This is Carmen, joined today with my co-host, Eric Farber, who is going to be introducing a special guest in a little moment. His name is Dr. Mark Sontag, and it's very interesting what we're going to talk about today. But I want to invite you to share this podcast with other people, subscribe to this podcast as well, and make sure you connect with us via social media. You can find us everywhere under WorkCompTalk, or you can also visit us on our website at WorkCompTalk.net. Eric, would you like to say hello?
Thanks, Carmen. It's good to be here again, and we do have a very special guest that we took out of his very busy schedule, especially right now, and it's Dr. Mark Sontag from Remedy Medical Group. And welcome, Mark. Thank you for being here.
My pleasure.
So, Dr. Sontag has a long history of practicing in physical medicine and rehab within the Bay Area for more than 20 years. And he did your residency at Stanford, is that correct?
Correct.
In physical medicine, and Northwestern University in a 6-year medical program. And Dr. Sontag was the team physiatrist for the San Francisco 49ers, the San Francisco Giants, a team spine and pain physician for the Sharks and the Oakland Raiders and the Earthquakes. Is there a team that you didn't work for around here?
Well, I have helped the Warriors, but I have not worked officially with the Oakland A's.
Okay, well, we got to get you to the A's since we're Oakland based, so they could use your help as well. But he also founded Spark Med, which is a functional restoration pain management clinic for chronic pain patients, which is really a very big deal within the workers' comp business as well. So we're going to kind of jump right in and start talking to you, especially. I mean, this is an unprecedented time, and we have had to make immediate changes to what we do in our practice and what we're seeing immediately. But why don't you talk a little bit about the practice that you have now and how that has been altered by the coronavirus?
Certainly. And thank you, Eric and Carmen, for inviting me to participate today. Remedy is a group of 10 providers, and our specialties are in pain management. We have 3 anesthesiologists, 3 physiatrists, 1 rheumatologist, 1 orthopedic surgeon, acupuncturist. And as you know, with the sheltering in place, the number of office visits has dropped dramatically. Patients that are over 65 have been asked not to leave their residences and certainly not to come to our office. So we quickly implemented using Zoom technology, telemedicine, and have actually found that to be very successful. For instance, on Tuesday, I provided medical care for 20 of my patients through Zoom. So the primary change has been using telemedicine to facilitate ongoing care for our patients.
So that's actually very interesting, because I think the whole idea of telemedicine has been raised so many times in workers' comp, and we've never been able to really get that passed through it all. So I think there's a lot of changes coming in the workers' comp industry, maybe for the better in the long run. with regards to with regards to something like this, right?
Correct. And my understanding is that the workers' comp payers will pay the same amount for a Zoom visit as an office visit, as long as there's a face-to-face interaction. However, if you cannot use, FaceTime or Zoom, and you make a simple phone call, there's a different fee schedule for those
Interesting.
interactions.
So, are you still doing office visits?
I am not. I am over 60, so I'm considered at high risk. Our younger doctors who are in their 30s and 40s are still seeing patients. We are using the CDC precautions, including taking each patient's temperature before they enter the clinic. We have all of our employees, we check their temperatures. No vendors can come in without their temperatures taken. We've told our employees and patients and vendors not to come to the office if they're ill. I also am the medical director of the San Mateo Surgery Center. We have 16 physicians, and we are able to do elective cases that are considered essential, essentially patients younger than 65 primarily.
Tell me about that. What would be an elective case that's considered essential?
There are specific guidelines. To summarize, an essential case would be where someone's ability to care for themselves or a loved one would be impaired. For instance, if someone has a herniated disc with radiculopathy and have severe back and leg pain and have had a difficult time caring for themselves or a loved one, then in that situation, an epidural injection would be indicated. If someone has a torn meniscus that's severely painful and interferes with gait, someone ruptures an Achilles tendon, those would be considered essential cases.
Torn meniscus meaning knee?
Yes.
Okay. And gait meaning
Walking.
what
Yeah.
affects their ability to walk?
Yes. So, with people sheltering, as you know, there's a lot of anxiety um, related to this uncertainty with the virus. And mobility is very important because we are encouraging patients to get outside and do exercise, get fresh air. So, if someone has an orthopedic injury that limits their ability to walk or go to the grocery store, then that's something that's viewed as essential.
So, um, have you had the necessity, or any of your doctors that you know of had the necessity, if somebody is on workers' comp that would normally be able to go to the grocery store, that you're actually prescribing somebody else to go to the grocery store for them, or some sort of service or anything like that?
As far as I know, I'm not aware of that having
Correct.
happened yet, though I do think that that would be a reasonable request.
Let's go back for a second, because I know one of the things that injured workers are really concerned with is simply, with what we expect to see in our healthcare system, is an onslaught, is an overwhelming of the system. How will that affect workers' comp and workers' comp treatment?
The delay in receiving care for the patients is a big concern. For instance, if someone was scheduled to go to physical therapy, receive acupuncture treatment, chiropractic care, those treatments would be delayed. And as we're well aware, the sooner injured worker receives the appropriate care, the more likely they will improve and be able to return back to work. So those types of services will be delayed, and that's not a good situation. We also are concerned about the authorization process. We're hopeful that just as your company and my company are utilizing workers at home, that the insurance carriers will also be able to do processing of requests for authorizations for instance, injections or psychological care or medications.
Talk about if somebody is over the age of 60 or in a risk group. And we'll talk about that in a little bit because you've mentioned it a couple of times, how they are going to receive care.
That's a challenge. Patients that are over 65 are asked to shelter. Patients that are over 60, particularly if they have pre-existing conditions such as respiratory conditions like asthma, COPD, congestive heart failure, diabetes, are considered at increased risk for having a terrible outcome, essentially death. So those folks, we have to use the telemedicine approach. One of the challenges is patients that are receiving opiate prescriptions or controlled substance prescriptions. In that situation, the physician will write the prescription and we will leave it at one of our 3 locations. Remedy has an office in San Mateo, San Francisco, and Oakland. So the patient's loved one or caregiver would have to come and pick up the prescription. All other prescriptions that are non-controlled substances, we can call in. So that's how we will help with that. And as you're aware, there are some new companies that will actually do deliveries of medications to the patient's home, which would be another venue of getting prescriptions to injured workers.
Let's say somebody is actually doing this on their own and they don't have a lawyer. Does your company have information about like the delivery services and things like that?
Yes.
When people do come to the office, I know you kind of went through this a little bit quickly at the beginning here, and I want to really, there's some of the stuff we may kind of cover twice, but this is one of the important ones, is when going to your appointment, whether it's at Remedy or anybody. I mean, there's plenty of companies out there. What kind of protocols can they expect to run into?
Certainly. We will ask, first of all, if they are ill, and that would be defined as having a fever, a cough, sweats, muscle fatigue, that they do not come to the office. Secondly, when they do arrive, we do check their temperature. And if they have a temperature generally above 100, we will not allow them into the clinic. We are keeping the doors open. So we're trying to minimize the spread of the virus because, as you're aware, the virus can live on doorknobs. We use very sterile technique. The doctors will maintain a 6-foot spacing, as will our employees. If the patient is examined, the doctor will use gloves. And then, we will have a normal office visit at that point and recommend the appropriate treatment. We'll try to call in the prescriptions to make it easier for the patients, schedule, typical follow-up visits.
Now, Dr. Sontag, I heard you mention that you guys are going with the 100 degrees for the temperature. Why is it at that number, 100?
Well, that's my understanding of the cutoff number where people would be concerned. I would refer to the CDC websites and to the specific county websites on those parameters. That's the parameter that we're utilizing at this time.
Great. How about, say, for example, that a patient needs to go in there for physical treatment, and due to the fact that they are at the age where it's considered higher risk, the physical treatment gets backed up or it just stops happening. What are the odds of this actually affecting them in the long run if they're not getting the physical treatment how they should be?
We're aware that the more aggressive the treatment and the sooner an injured worker receives the treatment, the more likely that they will recover and have a full recovery. I've actually published a book chapter on the distinction between acute pain, and chronic pain syndrome. And to simplify that, acute pain is usually pain that lasts less than 6 weeks. Subacute pain is 6 weeks to 12 weeks, chronic pain over 12 weeks. And probably 20 to 30% of the people that have pain that persists after 12 weeks develop chronic pain syndrome. And the syndrome is where the patients, in addition to having disabling pain, will also develop depression. And they will have very profound limitations in activities of daily living and their ability to work. So our goal as providers is to help patients get better as quickly as possible to prevent them from falling into that 3-month window where they're at risk of developing chronic pain syndrome, which of course is more difficult to treat. So basically, we want to get their treatment quickly. Our acupuncturist is still working. I'm unclear how chiropractors are handling this. I believe some physical therapists and trainers are using telemedicine. We do have a personal trainer at Spark, and he will see a patient alone in the gym. He's about 30 years old, and he'll only see clients that are basically under the age of 60. So there probably are still some physical therapists that might be willing to see patients in their office.
Would it be, again, obviously in the physical therapy centers and physical therapy areas, they may have, yoga mats, or they may have certain things that are used, blocks and bands and things like that. If somebody is at home with those things, are you treating them through that? Are they able to treat them through that, through telemedicine as well?
Yes, exactly. So with using FaceTime or Zoom, we can assist them doing the exercises at home. We also will provide them handouts. There are some good websites that are useful, but the one-on-one is very effective. Is everyone's probably aware of the Peloton model, where you're working with someone. You tend to have higher compliance and more intense workouts with appropriate guidance. Often, as you know, an injured worker becomes deconditioned. They have fear avoidance. Sometimes there's catastrophic thinking. So we need to assist them in that process of knowing that exercise in the long run will be beneficial and that it's safe to do.
Would it be right? We talked about having the possible prescription of somebody heading out to get things for them, daily chores if they shouldn't be leaving the house at this point. Would that also be something that they should ask their physician about, that they can't leave the house, but they can do telemedicine, but maybe order some of these things, through Amazon to deliver to their house?
Absolutely. Absolutely. So for instance, ordering the bands or the blocks, barbells, mats, those things would be accessible through Amazon.
Let's talk a little bit about the coronavirus and the stress. Comp injuries already cause a lot of stress for people. They are part of the, sort of three major triggers, job uncertainty, injuries, and lawsuits. I mean, they're all in the top 10 of things that cause the most stress in our lives. Up there with losing a spouse, divorce, losing a child, etc. And this is just one more big add-on, very big. Maybe the most significant that we've seen, certainly in our lifetimes, if not going back much further than that. How should people cope? What tools can you give?
And you've summarized that, beautifully. The fact that you have an injury is anxiety provoking. Pain is anxiety provoking. Inability to work is anxiety provoking. Decrease or loss of income, role model changes. So adding now the fear of the virus, the fact that your normal daily lifestyle is altered, the risk, perceived risk of not being able to get your medicines is very profound. So first of all, we offer Dr. Kim Harden and Dr. Yuta Made, who are both pain psychologists who have continued their private practice using Zoom. There's also, I'm happy to say that many psychologists across the country have volunteered their time to provide online care. I don't have the web link, but I believe if you did a Google search, you would be able to find that. So the country is unifying to assist patients who have, problems with anxiety or depression. Also, there are some basic things that everyone can do to reduce anxiety. One would be, most importantly, exercise. Two would be getting out into the fresh air and getting at least 10 minutes of sunlight. Three would be maintaining hydration. Four is eating healthy. And five, interestingly, might be the most important, is maintaining social contacts. Now, granted, you might be sheltered with a parent or a loved one or a child, but we encourage people to reach out by the phone, through Zoom. You still can hike with friends as long as you maintain a 6-foot distance. So basically, it's very important to try to sustain social contact during this isolating period.
It's funny that you said that in these trying times, it's almost as if we're also unifying as a whole, as a community. And it's true. If you do see the light at the end of the tunnel, there is also a lot of good that can come out from what we are facing now. And one of those things is being able to help others. And I have seen actually the ads of a lot of the that you can actually get help if you're going through a depression, if this is really just taking you down south. And that actually just comes to show that at the end of this tunnel, we will see light. If anything, it might just help us all around.
Yes, that's a good point, Carmen. Under stressful times, humanity generally rises to the occasion, and there's a spirit of cooperation and helpfulness across society, and potentially this could be a unifying experience for our country, which has unfortunately been so divisive politically the last years.
So I want to bring up just one more thing. We've seen a lot about personal protective equipment in healthcare, and that the Apple just announced they're donating 10 million masks. Facebook is donating some ridiculous number, and I actually confirmed from a Facebook employee that these were masks that they actually had on hand for their own staff, for things like the wildfires and things, and they're sort of going to their own personal or their own storage of these. But how is that going to affect a clinic like yours?
Well, some patients feel more comfortable wearing a mask, as do the physicians. It's important that the proper mask is used. The 6-foot distance is related to the particles that the virus can spread. So, for instance, sneezing, coughing, apparently maybe even talking, the virus can be spread through the air. And one of the key things is to avoid allowing the virus to enter through your eyes, your nose, or your mouth. So the mask, would reduce the likelihood of you spreading the virus, God forbid if you have it, and B, it would reduce the risk of the virus entering your nose or mouth. It would not protect your eyes. The virus can also maintain on clothes, on metal, on door surfaces. So that's why using wipes is a good idea. We encourage people to use their elbow when they're opening doors. Certainly no longer we're not handshaking, we're not even doing the elbow bumps anymore. So there are quite a few things we can do to reduce the likelihood of the spread of the virus.
If all the personal protective equipment is going to head over to the hospitals and the healthcare that are just dealing with the virus, how do you how do you think that might affect these basic clinics?
Well, I think a lot of patients are electing not to go see a physician. Interestingly, as we had talked about the essential criteria of what would be a reasonable case for a surgery center, I think the same applies now to workers' comp patients, where how essential is it to actually see the doctor? For instance, if it's a medication refill, Motrin or Naprosyn, or a muscle relaxant like Flexeril, um, Tylenol, those things can be done on the phone or automatically, because often the pharmacy will send us a request and we will go ahead and refill it. So I think a lot of the visits do not have to occur to begin with, including not having a Zoom conference. Some of them do need to occur, but can be done electronically through Zoom. And then a smaller percentage actually need the face-to-face visit. And in those situations, then the protective personal equipment can be utilized. The thing to realize is we are screening our patients in terms of their health before coming to the clinic. We're screening our employees. The aspect of this virus that's so unusual is that you can have the virus and have no symptoms, but still pass it on to someone else. And that's what's so different about this than like the flu. Potentially, maybe a day before you have symptoms with the flu, you might be contagious, but traditionally, you would be contagious when you have symptoms, which would make it easier for you to not spread them because you're less likely to go out in society. The thing that's unfortunately unique about this virus is that you can spread it without even knowing you have it.
Right. I think that's the scary part about it. Um, I think we've answered most of the questions in regard to someone that's actually going through a workers' comp case, or in general needing to go to the doctor. I feel it's safe to say that, things are moving forward. It's not like the clinics have just completely frozen and stopped handling the patients. So I think that relieves some type of stress to many people who are still trying to figure out how the world is going to function and how long we're going to be in this lockdown. So I'm happy that we had you on board, Dr. Sontag. Is there anything else you would like to add to what we've been speaking about that you think that our listeners should know?
I think take care of yourselves and your loved ones. I would keep track of the recommendations through your local county medical society and the CDC. I would also encourage you to reach out to your physicians, because they are prepared to help you through this challenging time. So I think there are resources available. And once the virus clears, the clinics will be open just like they were previously, and all the providers will do everything in their power to provide the proper care as quickly as possible to all of their patients.
Do you guys have tests at your clinic? Like if someone were to want to walk in there and say, "Hey, can you guys test me for the coronavirus?"
No, we do not. As you know, there has been a limit of the testing kits, and there are various centers where you can receive a test. I think this is important to note that we want to limit the utilization of the testing to people that show symptoms or are at high risk, because because the limitations of the number of the testing kits, we don't want everyone getting tested at this point. Now, at some point when we have more kits, maybe that would change. But the local hospitals, there are some drive-through clinics, so it wouldn't be difficult to figure out where to get testing. But certainly for our clinic, we do not offer testing.
Well, Dr. Sontag, thank you so much for coming on with us today. It's just quite a situation. We really appreciate it, and all the best to the people at your clinics and your patients out there. And we will make sure that putting people in touch. Can you give where can people find you or find your clinics?
Yes. So if you go online and place Remedy, you'll find us, REMDY. Also, Remedy Docs is our website. And for Spark, you could also put Spark, SPARC Med, and you will find us on the internet. The Remedy phone number is 650 306 9490. So that's one of the easier ways to reach out to us. Both of Remedy and Spark, as well as the San Mateo Surgery Center, have websites with the contact information, hours of operation, and locations.
And if you didn't have a pen or something, don't worry about writing it down. We will have it on our website on this episode page with Dr. Sontag. We'll have these notes.
That is correct. Dr. Sontag, it has been an amazing pleasure to have you on board today to answer all the questions that many of the people might have. And we want to thank the listeners as well. Thank you for listening to WorkCompTalk. This is Carmen Ramirez, co-host and producer of WorkCompTalk. We will continue to have different types of guests, and we want to encourage you to continue to follow us on social media, WorkCompTalk, Instagram, Facebook. You can also join us online at WorkCompTalk.net. And we want to thank our sponsor, Pacific Workers Compensation Law Center, the lawyers for injured workers. Pacific Workers is the leader in California applicant workers' compensation, representing injured workers in their fight for justice against the insurance companies. And you can find them on the web at www.pacificworkers.com. I'm Carmen Ramirez. Thank you guys for listening.